So today I'm going to discuss on adrenal insufficiency. So the adrenal gland has two layers. One is the cortex and the medulla. And the cortex produces corticosteroid hormone and the mineralocorticoids, which is aldosterone. So the adrenal insufficiency is disorder of adrenal cortex, which involves hyposecretion of glucocorticoid, which is a cortisol. So in adrenal insufficiency, the level of cortisol is decreased, but sometimes there could be also hyposecretion of mineralocorticoids, which is the aldosterone. Adrenal insufficiency is also called as adrenal disease after Thomas Addison, who first described the condition. For the diagnosis of adrenal insufficiency, we can check for ACTH. A low or normal serum cortisol in the presence of an elevated ACTH is diagnostic. What is adrenal crisis? So the adrenal crisis is life-threatening condition in which adrenal gland is almost non-functional, usually because of destruction of adrenal tissue. And this is very important for the NCLEX and nursing exam. In adrenal crisis, there is cardinal sign, which is hypertension, hyperkalemia, hyponatremia, and hypoglycemia. So to remember, you can remember the hypo part first. So there is a hypertension, hyponatremia, and hypoglycemia. The only thing that is increased is the potassium, which is hyperkalemia. Critical illness related corticosteroid insufficiency. So the adrenal gland are often unable to secrete adequate amounts of stress hormones, especially when critical illness is prolonged. This is described as critical illness related corticosteroid insufficiency or CIRSE. Now let's move to the adrenal medulla. Pheochromocytoma, which is a rare tumor which arises from the catecholamine producing chromaffin cells of the adrenal medulla. These tumors produce a far greater quantity of catecholamine than normal adrenal medullary tissue. So as you know, the adrenal medulla produces two kinds of hormones, which is norepinephrine or epinephrine. Epinephrine is also called as adrenaline, and norepinephrine is also called noradrenaline. It creates a catecholamine storm and a hypertensive crisis that can be life-threatening. So in pheochromocytoma, the hypertensive crisis is the main problem. And since it has a tumor, it produces a lot of norepinephrine and epinephrine, which increases the blood pressure. Here is the chart for sign and symptom of pheochromocytoma. Signs are hypertension, tachycardia, tachypnea, pallor, flushing, hyperglycemia or poorly controlled type 2 diabetes, decreased gastrointestinal motility. In symptoms, we have headache, dizziness, faintness, palpitation, chest pain, anxiety and nervousness, excessive sweating, weakness, fatigue, weight loss, constipation. That's all for adrenal gland.